So thrilled to have with us Dr. Michael Kafka. He is the medical director at St. Luke's.
Medical Director for Quality and Safety.
Good. Well, he's going to talk to us today about the coronavirus, COVID-19, all those things we've had questions about, and I hope you can answer some for me. The first thing I have, and I'm always wondering about, is what are the symptoms I should be looking for? How should I know if maybe something is brewing in me? Yeah.
The typical features that patients come in with usually have fever, but not always. About 40% initially went into the hospital in China, had fever, ultimately 85% got that. And then scratchy throat, dry cough, and shortness of breath, and maybe feeling fatigued or tired like you do when you're coming down with a viral infection. So it can be rather nondescript and hard to tell the difference between a cold and whether it's the flu or something like that.
And this is allergy season too, so that could be another thing that factors into those things.
That is kicking off now, so that's going to confuse things. Fortunately, the influenza peaks and cases seem to be declining, so we're having less of those kind of in the mix. So we're hoping as that phases out for the usual spring clearance, then yeah, we'll be able to maybe pick up these folks more rapidly.
Okay, so what should I do? Should I just stay home? Should I call someone? Should I go see my doctor? Go to urgent care? What do I do if I feel like I think I have it?
Well, if you're feeling well and feeling like you can handle this at home, really the idea is to stay home.
Just stay home.
Stay home. 80% of folks have mild to maybe moderate symptoms, but can manage themselves at home. But if you get to the point where you're having some respiratory problems, you're getting short of breath, are really feeling fatigued or running a high fever, then that would be the time to call the doc and call ahead, because they'll want to bring you in through a different door and keep you separated from the other patients that are there.
Somebody said that I should try to hold my breath for 10 seconds without coughing. Is that anything, or is that just a dumb idea?
Well, no, it might be an idea to trigger it, make you think, oh, there's something going on, but yeah, you'll know. People who have developed shortness of breath, it's very obvious that they're having problems in it, and they'll be aware of it.
Okay, so I'm with a family. Do I just go to a room by myself and you just kind of leave me there? Or what do I do? I mean, is it inevitable that everybody who's quarantined in a home would probably pick it up? Or
not necessarily. If everybody else is doing all the right stuff, ideally you get somebody into their own room, so they're by themselves, and limit their contact with the rest of the family members. Those that come in, and ideally, if there's a mask, he would be the person that would put on a mask.
Okay.
That's probably the one mask that needs to go on, if it's going to go on anybody. But otherwise, if others need to go in with them, they feel like they need a mask, they could put a mask on as well. And then at that point, just making sure that they're washing their hands thoroughly and being careful what they touch in the room, and also when they come out that they disinfect their hands and keep their hands away from their face, because this virus is unique. Not only can it be transmitted through a cough or sneeze through the droplets that are released, but those droplets land and they carry virus, and that virus can last for several days on surfaces. So if you touch it and then touch your mouth, rub your eyes, you can inoculate yourself and end up getting the virus.
Wow. Are there things I should eat if I get this? Should I drink a lot of fluids? Should I?
Well, whatever you would normally do with a cold or a flu, fluids, taking some medicines for pain if you're uncomfortable or achy, for the fever control, but no magic foods as far as.
Okay, it's nothing like just drink liquids. That's all you should do.
No, it's to try to eat as healthy a diet as you can, a normal diet.
And I assume that the symptoms are such that really it isn't going to make you feel like, oh, I feel so sick like we normally do with flus, right? It's not a typical flu.
That's not a typical flu with the really muscular aches and things like that, although that can occur, but can present ultimately just like the flu, because you can get a pneumonia, which is what is the real complication.
So it's the breathing thing I really want to keep an eye on to make sure that.
Yes, absolutely. It's when the shortness, if you start developing shortness of breath and things of that sort, that's the time that you need to be calling someone and maybe talk about going in and getting tested.
Okay, so then I call. What kind of things can they do for me? What can I get when I go see a physician?
Well, there is no treatment, unfortunately, for this. It's all symptomatic treatment at this point. So they'll check you out, make there isn't something else going on, may check, do a swab to see if you might have a sore throat or if you might actually have the flu, in which case they can give you some of the anti-flu medications, Tamiflu and things of that sort, to help you through that. But it's kind of but otherwise there's no bullet currently for treatment.
How long does it last?
For folks that have the mild to moderate disease, it's 1 to 2 weeks. For those that actually get into trouble, and usually those that are going to have issues, they're in the second week that they suddenly take a turn. Then it can take up to 3 to 6 weeks for those folks.
Oh, wow, so it could last quite a while.
It can last for quite a time, yeah, for those folks that really have serious disease.
Okay, so then your doctor would tell you maybe you need to go to the hospital. And what happens at the hospital then if I'm hospitalized?
Currently, if you're coming in and have that kind of a history, we would consider you what's called a person under investigation, or a PUI, according to the health department's terms. You would be, if you're admitted, you'd be placed up in a room, you'd be put in isolation. Folks coming in that would take care of you would be wearing a mask, and eye protection, a gown, and gloves, again, to avoid touching anything that you may have coughed or sneezed on, and also in case you cough or sneeze at them, to not have any of that spray hit them. And then treatment for whatever your symptoms are, and also probably start an antibiotic so that you don't get a secondary pneumonia, which is sometimes what triggers the more severe cases. They get something else that comes along on top of the coronavirus.
Now, when we see people who say, oh, I'm just going to go out, because if I get it, I get it, it's okay. But it really isn't necessarily us that we're worried about, it's people we might give it to, right?
Absolutely, yeah. There is a group that's very susceptible to the effects and have a higher complication rate. And those are the elderly. I fall in that category.
That's me too.
Yeah.
Here we are.
Yeah, people over 60, and also those that have chronic medical conditions to begin with, they very quickly can get into trouble if they develop the viral pneumonia, which is kind of the thing that actually triggers the most severe form of the disease.
So when we go out, I need to get groceries, I need to do those kinds of things. What precautions should we take in those situations?
Well, in our case, we go at 7 o'clock in the morning.
Right, we get to because we're older,
We get
right?
to the old person's, hour.
We never thought there was a perk to being old, but I guess there is one now.
One time it is, right. Again, maintaining a distance as you're on the aisles. They talk about people that are most at risk are those that have prolonged close contact. And the definition of prolonged is 10 minutes.
Okay.
And close contact is 6 feet. So, and they're actually revising some of the times down, but it isn't something just walking past someone in the aisle unless they happen to cough or sneeze on you as you're going by. You're not likely to pick it up. It isn't something that stays suspended in the air for long periods of time if somebody does cough and sneeze.
What about when I'm touching like the touchpad at a grocery store?
Yeah?
Do I need to wash my hands right away after that, or what do I do?
Well, you should. Yeah,
I should.
Yeah, I should. Yeah,
Okay.
Go and get some hand sanitizer and either wash your hands or use an alcohol-based sanitizer. Yeah.
Okay, and should I carry wet wipes with me at all times? I
do
sound
when-
so paranoid.
I do
You
when I go out, yes, yeah, we carry little packets if you can find, the trouble is it's hard to find them now because
Right.
they've been picked off the shelf, but yeah, cleaning your hands frequently, particularly around in public areas, touching things that other people touch, those are the things that you need to really frequently clean your hands.
How safe is hand sanitizer? You know, we hear, oh, if I just put my hands under some Purell, I'll be all right, but is that really, that's not the only thing you should be doing or could be doing, right?
Well, like I say, it's what you do with your hands, which is really important too. But yeah, the hand sanitizers work. They have to be at least 60% alcohol. And people are getting real creative. There are some
They're making them.
there are some distilleries that
Yeah.
and there's a group over in eastern Iowa, and we're trying to get a hold of them to see what it is, and yeah, because that's the biggest fear that we have in the hospital is the lack of personal protective equipment, the masks, the gowns, and things that we are going to need when people come.
How are we sitting at this point? I mean, certainly we haven't had that many cases in our area, so we've been lucky from that perspective. But
Right.
how are we in terms of our medical personnel? Do we have enough to handle this? Do we have enough supplies? Do we have all of those kinds of things, or where are we?
Well, right now, we're fairly well stocked for the number of people who are coming, because we do have people coming into the hospital that are under investigation, and they're sick enough that they need to be in the hospital. And like I said, at this point, none of them have actually had COVID-19, some other viral illness that's caused a viral pneumonia for them. So we are handling those folks. Yeah, we're just hoping that the surge, when it comes, is going to be maybe that same number, and maybe a few more, but hopefully nothing that's going to overwhelm us, at least here in the Siouxland area.
And what do your people do? What kind of things have you advised them? Are they wearing masks all the time? So if I come to the hospital, am I going to be just freaked out because I see all these masks around? Or is it only when they're in contact with certain people, or how is that?
Well, it's interesting. There was from our health system, UnityPoint Health, they just sent out an announcement yesterday that all direct care personnel wear masks now, full-time while they're in the hospital. So that's going to put a crunch on the mask supply that we have, which we've been holding steady, but we're on what's called allotment. We know that we're going to only get so much each week, can't get anything more than that, so we're trying to be very conscious about who is using it, particularly the N95s, which would be for those that might be need to be in isolation and intensive care and the more seriously ill folks. And we're trying to come up with creative ways to extend the life of using masks, not just for one patient, but maybe you wear it for 4 hours until you take your break and go to lunch, and then you get yourself another mask, or things of that sort.
I've seen that people have said, well, we can make masks for them, but those aren't necessarily what you're looking for, right?
Not at this point, although we're going to have some information coming out from the health system, I think also including Mercy One. We've been working very closely with them every day, talking about what they're seeing and what we're seeing and what we're doing creatively within our facilities to get ready for this. We are going to eventually be accepting masks as they come in. Exactly what role or use they're going to be, we're probably going to be more of a last ditch kind of thing that we'll be using, but we appreciate the community's interest and desire to help us out. We do everything we can, everybody,
What about rubber gloves? Are they in short supply, or?
Gloves have not been, the major issue has been
masks.
And eye protection, which are the things that are most in short supply at this particular point.
Another thing that I find that I hear people talking about is the stress that we all feel.
Yeah.
How can we deal with that? How can we, last night I started a puzzle. First time I've done a puzzle in so many years, I can't tell you the last time I did one. But it was something to get my mind off of this.
Yeah.
And what are some suggestions that we can give people?
I was going to say puzzles. My wife and I, we started, probably had a Christmas time, I think, when we started. It was before the whole COVID thing started. We decided when we were initially married, we would do puzzles during the winter. So we have been knocking off 1,000 piece puzzle weekly. And it's amazing. You can sit down, you can work at it for 2 hours, and you totally lose track of the things that can nag you. So those kinds of things, reading, going online, but not too much, not necessarily going out and looking for what does the COVID virus do and how does.
And I think a lot of that scares people, and I think a lot of it is not accurate.
Yes.
And I think that's where people go wrong, is they go to the extremes, and then immediately it's like we're doomed, and that isn't the case.
No, but this is really, really serious, and this is really going to stretch us in terms of a health provider and a community. So it's not a sprint. It's going to be a marathon.
How do we deal with just people in the house? You know how I might be really mad at you because I have nobody else to lash out at? How do I deal with that?
No, I have been doing meditation, things like yoga, things that you work on being kind to yourself and think about being kind and generous with others, and trying to develop a mindset and kind of reminding yourself of that, throughout the day.
And maybe get distance.
And some distance helps as well.
I hate to say that, but you know what I mean, where you say, all right, we're having our hour alone time or whatever.
You go downstairs, I'll stay upstairs,
Right, yeah, because I do think those are going to be continuing problems if we're going to be quarantined for a period of time.
This is going to be a mental, emotional challenge for folks. Not only just the concern about could I ever come down with this and what's going to happen if I do get it, but school's off, business are closing, so people aren't working, financial concerns. There's a whole other layer of stuff that's going on besides just the medical issues that are at hand.
So we just have to, maybe it is a spring break for us. Maybe we need to take a break from everything that we worry about. And
and I think the other thing to do is to think about reaching out to others in random acts of kindness, and think outside yourself and think about others, and there's great satisfaction in being able to do something for somebody else, and it's that kind of level of gratitude and concern for others. I think you kind of have to make that your mantra for the day. When you get up in the morning, you got to remind yourself that going to focus on that, and when you go to bed, congratulate yourself on what you did at the
I'm
end of
not
the
so
day.
bad after all, right? I make sure I set a schedule, because I
Yes.
figure if I just kind of sleep in every day,
Yeah.
what good is that gonna do me? And I try to make sure I get something accomplished every day. Now, I am going to get the whole house cleaned at some point, it's gonna be great. I don't know that I'm there yet, but, because I stopped for the puzzle.
Yeah.
But I think if I do have a plan, it's gonna be a little easier on me in terms of getting through all of this.
And gives you a sense of control over your environment, and you're calling the shots in terms of what's going on, so.
Right.
Yeah.
Well, now, give us some advice. What, because it is a long haul through this, what should we look for? What should we consider? And what should we think as people in Siouxland about how we're going to be affected?
Gee, that's a long question.
I know it's a long question.
Again, need to think about taking care of yourself, getting sleep, eating well, not letting yourself get run down, think positively about what's going on. Adhere to the recommendations about social distancing, not congregating an area. When the weather's nice, go out and walk, go out and run, enjoy nature, do those kinds of things. And try to, like I say, reach out to others. I think that's the isolation and being kind of on your own and letting your mind race. It always, when there's lack of information, you always fill it in with the worst possible
Right.
scenario.
Right.
And I think doing that and paying attention to what's going on, and just realizing that I really do have a part to play in this. My behavior can be very directly impact someone else's health. And so I need to be cognizant of what I do with the stuff that they're saying about the distancing. It works, but everybody's got to do it.
Sure,
So
sure.
Yeah, and being patient with others too.
If I get it, could I get it again?
I believe well, we haven't been around long enough.
Right.
Speaking of, I thought, you're a movie critic. If you had to pick a movie theme song, it would be Around the World in 80 Days.
Oh,
This virus has succeeded in doing this, because this virus, in essence, didn't exist before January 1st of this year. It was something that was just brewing in December, and we're not even 90 days into the year.
so here
And
we are.
And it's everywhere. It has succeeded in parts of Africa and things like that, where there's not a lot of
Right.
international travel. But yeah, this is kind of an unprecedented.
So we really don't know. So the idea that if I have it, I'm good and I'm out of it.
But I think the belief is, the experience that we have with other coronaviruses, and there are 4 other coronaviruses that normally circulate with the normal cold and flu things every year. So we've all probably had coronavirus infection, but not this specific one.
Okay.
I think the belief is that if you get exposed to this, you should have an immunity to it. So that is the one plus side.
There is an upside to
Yes,
this.
there is.
Good.
Yeah.
Well, thank you so much. We appreciate it. Good luck. I know that your job is much harder than our job is, but keep us posted so we know where everybody is and what we need to do. If there's something we can help, I know that we would.